So I'm here with Stacey Castaldo. And Stacey, for those of you that or who don't know you, can you just describe yourself? Tell people who you are.
um, so yeah, I'm a SoCal native. I just finished PT school last year, and we're talking about my article on concussion because when I was part of your climbing group, I was concussed, and
Yeah, this I know this comes from personal experience, right?
yeah, yeah.
And
So I I didn't really have concussion on my radar as far as something I was interested in for physical therapy, but after my experience, it's something I'm really interested in. So.
yeah, and it's interesting how this, plays into climbing because, concussions happen. And I know in the article and in this discussion today, we're going to talk about the signs, the symptoms, what happens, what to do after, rehabilitation aspects. But this is something that's not talked about that a lot in rock climbing, and it's yeah, it's kind of exciting to have you on. And I know you had your personal experience with this, which I think really shaped this article and shaped a
Yeah.
lot of the research that you did. So I'm excited to dive into it. So I think the first thing, people are listening and also viewing on the YouTube, and I know there's some graphs and some uh, videos of exercise, things like that. But for everyone that's listening right now and viewing, like what happened? Like break down what happened with you, and then we'll talk about like the concussion itself.
Yeah, so I just started climbing a route. It was new. It was the first time on it, and it was in
And
this
when
like
was this?
really.
How long ago was this?
Oh, this was 2022.
Okay, so not that long ago, because we're
No,
recording
no,
this right now in the start of 2024.
yeah. So it was it was October. And yeah, I was just it was the second bolt. And I think what happened was this corner was so shallow, and I turned my body into the wall and then went straight up. And I mean, next thing I knew, I was just hanging there. I hit my head really hard. But
What did you hit it on?
initially,
Was it on?
a
It was, I
bolt.
guess, on the rock. Oh,
It was a
really?
bolt.
Oh, no
Yeah,
way. Oh
yeah.
my God. And I
Uh,
mean, were wearing a helmet?
no, it was
Okay.
inside.
You're like, it's sport climbing.
I was
Did you need
inside.
a helmet? Okay.
I wear one outside though. I will have everyone know that. Um,
Yeah, that should actually be a take-home message. I'm assuming, from this. But okay, so no helmet. You hit a bolt on the second bolt, and
mhm.
what happened right after that?
I mean, it took a second to realize, hey, I hit my head, and there's always that stunned feeling, and I had my hand on my head because it hurt, and my partner's just saying, yeah, you should come down, I think, and I'm just like, no, 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 I just got to shake it off, and I'm gonna be fine. Um,
Any
and
any
then I looked at my
bleeding
hand, and
or
it was bloody, and I was like, okay, maybe I
okay,
should
that's what I
come
was gonna
down.
ask. Oh wow. All right. So then you're like, all
Yeah.
right, maybe I guess I can't climb now because my hand is wet. So I should probably lower
Oh
down.
yeah, I was, like most climbers, it's like I'm fine, I'm gonna keep going. But yeah,
Sure.
I mean, we stopped climbing after that. I had to go to urgent care and get some staples. So, but really, I mean, I thought that was it. I thought it was just a head laceration, and I really didn't start to notice other things until 24 hours later.
Now,
Um,
did you went to urgent care? Did they do like a CT scan or anything to, because you did have head trauma?
Yeah, no, I mean, initially they wanted to send me to the ER because they said they didn't have the equipment to screen
Yeah.
me. And I was
And
like,
to
no, I'm
screen, I'm assuming ruling out like a subdural hematoma or something like a bleed in
probably,
the brain, right? That may happen with a head
yeah,
injury that's associated with blood, right?
yeah. So, but I was like, hey, I'm a PT student. I'm not dizzy. I didn't lose consciousness. I'm not showing any signs of anything. So I just need my head sewn up. Um,
Okay.
so that was it. Uh, and I thought I was okay until the next afternoon. And like I said in my article, we were standing in a hallway. It was before class. There's 35 of us in this hallway, and we're waiting for the professor to get there. Everyone's talking to each other. It's really loud, which normally has absolutely no effect on me. But it was overwhelming. It was panic inducing.
Mhm.
I was like, if this goes on any longer, I'm going to freak out. I've never had that sensitivity to noise before. And that made me think. I mean, it was alarming to me just with my background. I knew what that meant. So, and then I just started to notice things over the rest of the day. I think I had one more class after that, and the same type of thing happened. And then I went up to my professor, and I was like, I need to go home. I think I have a concussion.
Yeah. And so did you go home or did you go to the emergency room to get things checked out?
I went home.
Okay, you went home. All right. So
Yeah.
any like people that are listening now, because medical providers listen to this as well as climbers that aren't
Oh,
medical
great.
providers. If someone is climbing, they take a fall, they hit their head, they have a concussion, right? And potentially these concussion signs, which I think you're going to describe in a moment. One is maybe describe the signs, and then like what
Mhm.
should you do, like if you have any of those.
Not what I did. Um,
Not what you did, yeah.
no. I mean, I eventually did go to the health center and get checked out.
Yeah.
And as we'll get into later, I mean, there still were things that were so subtle that didn't get caught in that affected my return to climbing. But as far
Mm.
as like safety day to day, I was okay. Um, but the signs are different for everyone. I mean, there's ones that are more common, obviously, and ones that are definitely considered signs of more of a serious concussion. Um, typically it's stuff you would kind of suspect. Being dizzy, blacking out is people obviously think of that one. Feeling nauseous, vomiting, headaches, feeling off balance. The vision and noise intolerance is also very common. Um, but there's other ones too, and this was the big kind of learning experience for me because I wasn't really aware of how profound some of these can be.
Mm-hmm.
Having trouble sleeping, mental fogginess, emotional disturbances. There's a huge array of symptoms with concussion, and there's really no concussion that presents exactly the same for anyone. So it's going to be very individual.
Yeah,
But
I
I
mean
would
there's like
recommend if you hit your head, just go get screened. Um,
and
make
does
sure.
that mean like go to the ER, go to urgent care, go to student health center, go to a physical therapist? Like what
Um,
does that mean? Get it
I
screened?
think urgent care is probably sufficient initially, and
And then
if they
they'll triage
suspect,
and refer you to where you
yeah,
need
if
to
they
go.
think that you need to go to the ER, they'll tell you. And at the very least, if it's delayed and you start noticing symptoms, I would go see like a primary care or sports. There's a lot of sports medicine doctors that specialize in concussion as well.
Yeah, but definitely seeing a physician. And I know in the article you talk about there's like depression, anxiety, irritability, like
Yeah.
your reaction time changes. There's just so many different signs and symptoms that may occur. So, all right, so someone gets a concussion, they go to see a physician, they get that screened. Um, you went through that process just a little
Hmm.
later, I guess, for that kind of
Yeah.
secondary screen. And yeah, and then when did you start feeling certain symptoms and what symptoms were they so people that hit their head can kind of be aware of these or I
Yeah.
guess they're all different but maybe be aware of your experience.
Right. So once the noise intolerance hit at that like 24-hour mark, I mean, stuff started popping up. Uh, so my situation, and I think what ended up contributing to my struggle with the persistent post concussion symptoms was we had just gotten a new puppy like a
Mm-hmm.
week before that, and my husband went out of town the week that I got concussed, so I was left at home with the new puppy, which means no sleep. And sleep is a big part of concussion recovery. You don't want to skimp on sleep, especially the first couple weeks. So that didn't help me.
Yeah, and I'm assuming
But
a new puppy is like I mean to
she
some
was,
extent like having a
yeah.
baby, right? You have to like care for it, clean
Mm-hmm.
up after. Yeah, okay, I don't have a baby, so I don't want
Yeah.
a
Well,
puppy,
she was
but
just
I
waking up every
understand the
2 hours.
responsibilities. Yeah.
Yeah.
So
So,
you were in a suboptimal life
yes.
position, with caring for something else before you could care for yourself.
Yeah, but I had a lot of emotional disturbances. I had a lot of anxiety.
Mm.
The mental fog was a big one. I couldn't
And you're in school,
concentrate.
you're in physical
Yeah,
therapy school during that time. I mean, that's, I'm assuming you have to study for exams and things like
I
that.
had to get a lot of extensions for the next month.
Yeah.
Um, but I mean, they were great. Everyone accommodated me, but yeah, it was a process. Um, that was kind of the biggest ones for me, was just mental fog. I was very tired. My emotions were a little all over the place. Um, so I mean, the more subtle stuff was what I experienced, which was the most interesting thing to me, because it's really not what I thought of
Now,
going into
now,
this.
did you go to a physical therapist for treatment? Like after you've
I
let's say, someone hits their head, they go and see a physician, they get diagnosed with concussion or post-concussive syndrome,
mhm.
um, and then they have to rehabilitate to, like, I'm
Yeah.
assuming, to help them out of what they currently feel and have some type of return to sport program, so, or return to climbing. So did you end up seeing a physical therapist or someone to help you
I
with the symptoms?
I did. Yeah. It wasn't right away, because normally concussions, resolve on their own in 2 to 3 weeks. Um, Obviously, the younger you are, the faster it usually happens. But so, I mean, that's kind of what I was hoping would happen for me, is that I'd be okay after a couple weeks. So I didn't climb for a couple weeks. I didn't really exercise for a couple weeks, which was actually not the best idea. I found out later, but I tried to start exercising again, and it was really tough. I was having a lot of problems. I would get these massive headaches. I'd get nauseous. My heart rate was all over the place.
Oh, wow.
So after about a week of that, I went to see. I have a colleague and friend that's a climbing physical therapist, so I went to see him.
And at any of this, during any of this, like, process, did you take like a standardized concussion assessment, like a SCAT-5 or something like that, which is like a questionnaire and a series of different tests
Yeah.
and measures? And I know you have to have a baseline of that test to
Hmm.
compare to, and maybe we'll talk about that in a moment. But
Yeah.
did you do any of those standardized tests?
They did something at the health center. I can't remember
Okay.
which one it was, but it was basically a symptom questionnaire, and they diagnosed me with a mild concussion.
Okay.
Uh,
And for anyone listening, I just want to, climbers sometimes are quite proactive and
mhm.
like go hard at things. So if anyone wants to look up SCAT 5, the number 5, online, and download a PDF, and you and your climbing partner, it's like a series of like mind games and questions and some
Yeah.
tasks. If like you and your partner do it on each other and score it, you now have a concussion baseline. So then if you do get a concussion, you just retake that test and see if you scored as accurately as prior. And then you're actually in good shape. Or if you have a detriment, then you can identify it and track that over time with the test. But I probably not many people listening are going to take that, but it is really nice to have that baseline if something happens. And I just want to share a funny story. In the NFL, someone was telling me, in the NFL, it's actually, they all have to do it, right? They all have to do their concussion SCAT 5s or whatever the assessments are preseason. And what does a smart NFL player do if they're taking the concussion comparison at the start of the season? Is they purposely do bad on it. So when they hit their head, they get a concussion. They actually, will also do bad on it and then get to play because their comparison isn't that much different. So I thought that was actually an interesting kind of nuance. But anyway, back to action. So Stacey, so walk me through how physical therapy, how that first visit was.
Good. I mean, I was pretty far in at that point. So we
Far
talked
in as
about,
far as like like your symptoms
yeah,
had
I think it had been 3 weeks
resolved.
since
Okay.
I had been concussed. I mean, I was still kind of tired
Wait, Stacey,
and
let's start one more time. Sorry. I think your screen is tilted higher than it was before. Or like there's a lot of overhead space, if that makes, there you go.
that better. Okay.
Yeah. Let me just put one note for the time code. 20. Okay. Yeah, that's better. All right. So, Stacey, tell me how your first day of physical therapy went.
Good. I was about 3 weeks in to, or since the concussion, and my main problem was now trying to climb and do yoga and strength train again without feeling nauseous and having a huge headache the next day. The interesting thing is during my workouts, I felt fine, which made it difficult to kind of gauge how intense I could be. So I didn't really find out if I had pushed too hard until, the end of that day or even the next day. So that's kind of what we were focusing on. And um, the main testing that we did was a lot of vestibulo-ocular reflex testing. Um, and we found a lot of subtle things that they didn't pick up on at the student health center.
Mm-hmm. And
But
just for
my
those that are listening that don't know what, that testing is, just like very briefly, just describe like what it is and what it's for.
Sure. So your vestibulo-ocular reflex, it's VOR for short. Um, you have neural connections in your brain that connect your vestibular system in your inner ear with your eyes, with the muscles in your eyes, so
Which is
that
basically vestibular is your balance center.
yeah, so it senses where your head is in relation to gravity or
Yeah,
upright.
and it's always when describing this to patients, it's always like, are you making this up? But they're basically like semicircular canals with crystals
Yeah.
in them in your inner ear that help you align your orientation. They have all these neural networks to your eyes, to your brain to keep everything, equal both sides
Mm-hmm.
at a baseline. So they did this testing, and it's with, they did the, yeah, maybe talk about just briefly the test that you didn't do so well on.
So yeah, we did like a Dix Hall pike for BPPV, which is where the crystals that you were just talking about get dislodged, and all that was fine. And then we started doing what's called VOR testing, where you are moving your head and trying to fix your eyes on a either stationary or a moving target, depending on how high functioning you are. So, I was pretty high functioning, which is why my symptoms were more subtle. So we really had to get to like the higher level VOR testing and exercises in order for me to start experiencing my symptoms.
Yeah, and you're
Um,
looking, I guess, for symptoms, and you're also looking for, saccadic eye movement, or, the
mhm.
the eye, instead of tracking smoothly, to like jitter, as it's
Yes.
moving in different positions. And
Yeah. You're also
so
trying to bring on the person's symptoms, which for me was just feeling dizzy and nauseous.
got it.
Um,
Yeah. So you have both. You have these symptoms, and then you have these like visual occurrences that you're looking at, as a clinician. And I mean, it sounds like these brought things on. And you then had this series of tests and measures that said, okay, these are your baseline assessments. These are the things that are generating symptoms. Let's treat and figure out how to return back to climbing. So the thing I'm interested in, because I don't want to dive too much into the weeds and the details. That could be its own podcast episode on all these different tests and the relationships. But how do you return to climbing, and is there a standardized process? I know you spoke about this, in your article, and even shared a table, but yeah, kind of share that process so a climber has a framework that they can use with a physical therapist, or a physical therapist has a framework to return a climber back on the wall.
Sure. So there's going to be on the wall protocol, which the chart I'll pull up in a second is very helpful for a graded return to climbing, and then off the wall addressing your individual symptoms. So for me, that was doing VOR exercises, but depending on what the person's experiencing, there might be other things. So let me share the chart.
Yeah, and this chart, is pulled from, correct me if I'm wrong, the Climbing Escalada Concussion Protocol, which Canadian Climbing's national governing body, has for climbing, has an actual protocol that if a climber in competition has a concussion, the Canada is really, really pushing the bounds on uh, standardizing health and development, and this was part of their process with climbing that then you were able to share in this article, if that's correct.
Yes, and it's really detailed. I think they do a great job of making it easy to understand and follow. Um, but do you want me to walk through it a little bit?
I think just briefly, I mean, there's a table right now on the screen. If people are watching, if people are viewing, we don't want to, or sorry, if people are listening, we don't want you to get too lost. But just maybe
Yeah.
briefly, in like a minute and a half, break down the overall structure. And then obviously in the show notes, if you want to see the entire table, you have access to it. But Stacey, just break down in general, like what the field of the progression is, and then we can move to maybe some specific exercises.
Okay. Sure. So the standard recommendation now is to take 2 to 3 days um, of just rest, and no more than that. So that was my big mistake, was I took way more than that. But
Yeah, it's
they
interesting
really,
because people may want to just like rest it off or sleep it off, right?
yes. So really, no more than 48 hours of complete rest is recommended. That actually might slow your recovery. So that's
That
very
that sounds like a
important.
huge take home. It's like one,
Yeah.
wear a helmet. Two, rest just 48 hours. Or two, see a medical provider, and then three, rest like no more than 48 hours. Those seem like some heavy hitting take homes.
Yeah. All things I didn't do.
Okay.
So basically, it's a stepwise strategy. So you move through these steps, and you assess your response afterwards. If you don't have any increase in symptoms after 24 hours, you can move to the next step. If you do, then you go back a step and give it a few more days, and then try again until
And yeah,
you
and I
really.
like how there's 6 steps, but I like how it's milestone based instead of time based. So it's not like, all right, week 2 you do this, week 3 you do this. It's like, no, if you pass on this step, you get to go to the next one, which is nice because everyone is different.
Exactly. So yeah, it's, as far as climbing goes, you start top roping, and top rope on vertical terrain, so that when you hang, that you're not swinging far out from the wall. Um, I learned that from personal experience. That can be very aggravating. And
Oh
then when you
wow,
start,
yeah.
yeah, when you start leading again, take a graded return to falling. Don't just start, taking whips all over the place. Take one, see how you feel for the next day, and then if you're okay, then you take two the next session, and so on and so forth. And
And I
then it
assume some of that's confidence driven, but the majority of it is driven by that velocity component of maybe generating symptoms. I'm not sure. I mean, we've climbed together. You're taking falls, like it's been 2 years since. Like I'm like, oh man, Stacy's going for it. But yeah, did you experience like any symptoms when you were returning back to climbing and starting to fall, or was it more just like anxiety was keeping you from kind of cutting loose to the level that you were at before?
no, it was the symptoms.
Okay.
I didn't really have a ton of anxiety once I started working with John, who is the climbing PT I was working with, because I felt like we had a plan. Um, I didn't really look forward to maybe having symptoms, but I really wanted to get back to full strength, so I was willing to test it out.
Okay.
But I
All right.
did
So there's
definitely
this.
have setbacks.
Yeah. Yeah, I'm sure. I mean, but there's these stages, 1 through 6. On this table, there's your physical preparation, non-climbing movements, sports specificity, bouldering and rope. And it sounds like, you take a short rest break, you start easing back into, top rope climbing. And then, yeah, what's the general progression from there?
So I think one thing to mention for sure, and this is on the chart where you see the asterisks and it says position restrictions. I describe those further down in the article exactly what those are, but you want to avoid positions where you're either at risk of hitting your head or your head is below your heart, because that's most likely going to be aggravating. Uh, and then, yeah, so it's also you have to look at your climbing intensity too, like how much you're getting your heart rate up, and progress that gradually as well. So you go from top rope only, and then maybe lead climbing a few pitches, or bouldering and down climbing to maybe taking a fall from halfway up a boulder problem, and just kind of progress stepwise back up to what would be full intensity for you.
I just love
Does
how
that
this
answer your
is,
question?
yeah, and I just love how this is outlined. It just gives a structure. I mean, a lot of it's intuitive, right? You're like, all right, I'll start top roping. That's lame, and then and then I'll do. Sorry, nothing lame about top roping. If you're listening and you top rope, that's amazing. That's great. Go for it. Be you. I just don't like it. I don't enjoy it. But anyway,
Me neither.
you start at a kind of a safety level, and you build up, and you make things more challenging. But there's nuances, and I love how there's the asterisks built in here, because yeah, you may not think of these small nuances, swinging away from the wall, or, having your head, you're in a cave bouldering. No, you probably shouldn't do that, early on, kicking your head back and things like that, where this all kind of makes sense. So kudos to the group up in Canada for putting this together. So we have this return to climb progression. We have these different stages, and then this is supplemented by other exercises, right? You're in physical
Mm-hmm.
therapy. You're just not showing up and going through, okay, what's my next step? You're doing other things. So maybe describe, just in short, a few different things that people can expect to do in physical therapy or in rehabilitation after a concussion.
Yes. So it will depend, obviously, on your symptoms, but the most common things are going to be neck pain and neck tension related headache treatment. So that's going to look a lot like what you would do in a PT clinic if you were just coming in for neck pain in general, or neck tension related headaches. Lots of neck stabilization exercises. And then any manual treatment that to help with neck tension. But basically,
Yeah, so
you're trying to.
mobilizing, the physical therapist will mobilize the joints in the neck. They'll do some work on the soft tissue to relax it, and then they'll strengthen and stabilize to get that. I guess the head's a bowling ball, so to get that bowling ball on a stick in the
Yeah.
right position, coordinated. And also, I mean, did you do any laser retraining where you put a laser on your head? It's called joint position air testing, and
Mm-hmm.
you turn your head, close your eyes, and try and resync some of the proprioceptors in the neck?
I didn't, but I love that stuff. One of the clinics that I interned at during school had that whole setup, and I used it a lot, and it does give great results. So I wish I had that, because I did have a lot of neck pain and headaches
Yeah.
for a while. But
So
definitely that would
yeah,
be
so maybe
helpful.
highlight an exercise or two that someone would do, and then we'll kind of wrap things up with our. I think we've already addressed the key take homes or the key points, but we'll.
Yeah. So we'll start. This is going to be the most basic. Um, starting laying down on your back, and then just practicing tucking your chin and activating those deep neck flexors.
Yeah, so for those of you watching the video,
Ooh.
Stacey's lying on the table with her knees bent. She's making a double chin, basically tucking her chin back, and then if it loads, if the video loads,
Yeah.
you'll see her
Here it
kind of
comes.
lifting her head off the table. And we don't have to like watch the videos. We can even just look at the pictures. But that looks like, one of the exercises. I know later on in the article you have some band exercises. Maybe
Mm-hmm.
scroll to those.
Yep.
Those are
So
interesting. They always
that's
seem goofy when you're doing them, but maybe just describe. You don't have to play them, but because people can see
okay.
the photos and hear your description, but maybe describe what this exercise looks like. It looks very cool, but yeah, describe what it looks like.
I don't know if I've ever heard anyone call neck exercises cool looking. Um,
Oh yeah, it's if you're a physical therapist, we think these are cool. These are some these are some of the if you have your patient in the clinic having a band around their head, ninja style, doing different exercises, they'll draw some attention. So
I like that ninja style. I'm going to use that. So yeah, so basically you're trying to keep your head still with these, and the band is obviously around the back of my head in the top one. So what I do is I just pull my arms away from my head to put some tension on the band, and then I have to use my neck muscles to stabilize my neck to prevent it from being pulled forward. And it's the
yeah,
same
so you
idea with
basically oh keep going.
the one below is the same idea, except I'm just pulling off to the side. So you're just working the muscles all around the neck.
Yeah, and I guess the idea is you just keep your head in one place and then you try and pull it to the side with a band. And the hardest part of this, obviously, keeping your neck stable, but also not tensing the large muscles in the neck. Kind of keeping those relaxed and focusing on the smaller ones.
Yeah, exactly.
Okay, great. Well, yeah, you can unshare those unless there's are there any other exercises you wanted to
I think I
describe?
started moving out of sitting. Obviously, you're going to want to move to upright eventually to be more functional. So, one of the progressions is then to go into a quadruped position, like you see in the bottom. That adds gravity to the band, so it just makes it a little more challenging.
So like quadruped, like hands and knees, right? And now gravity's like
Yes,
pulling your head down, and the band is behind the back of your neck, and you're trying to lift your head up.
right.
Nice. All right. So first of all, what a story, and what a this is what you've gone through, right? From having the injury to rehabilitating to writing an article about it, now coming on here and sharing. It's pretty incredible. And to now back climbing strong or climbing, and without having those barriers or limits. What are your take homes? If someone's listening and if someone's listening and they haven't had a concussion, let's say that will be your first set. And the second, if someone's listening and they have had a concussion, what are your take homes? So what are the big take homes if someone hasn't had a discussion? They're just listening.
I think that's is. I mean, wear a helmet, but I mean, most people don't wear a helmet climbing indoors. Let's be fair. Um, but definitely be aware that if you hit your head, you don't even have to hit your head that hard to get a concussion. And I think that was something that wasn't I didn't think at the time, which is why I didn't go get screened right away, which is the second take home. And also, I mentioned in the article that there's been studies that have shown that good neck stability is a good preventative measure for concussion. I mean, might not prevent a concussion outright, but it could help ease the recovery time. So just doing those exercises we went over in general. I mean, climbers don't have the best neck health just from belaying, and climbing in general is not that friendly to your neck. So I think if you're, in a preventative stage or you just haven't had a concussion, that's a good thing to put into practice. And then
And then,
if you're
yeah, oh, sorry, keep going.
if you're listening and you have had a concussion, and you haven't been checked out, I would highly encourage go get a screen. If you're having trouble, you're experiencing symptoms, it's hard to get back into exercising. If you're not doing aerobic exercise, that would be the best place to start, because that's a huge takeaway. One of my huge takeaways from doing the research for this article is how beneficial aerobic exercise is for concussion recovery. And then, if it's problematic and you're having a hard time figuring out how to get back, go see a physical therapist. Go work with a physical therapist to help guide you through the process.
Yeah, absolutely. Well, Stacey, thanks for sharing your story and your knowledge on this, and I'm
My
sure
pleasure.
that a lot of climbers that actually end up getting a concussion and then search on Google will track down this podcast many years later and learn from it, and then hopefully it is some preventative measures and some knowledge for other climbers, or if someone has a climbing partner that does hit their head. So thanks for coming on, thanks for sharing, and I think we're lined up. Was it next week or in 2 weeks to do some climbing?
Next week,
Next week. All
barring
right, sounds
no
good.
events. All
No
right. Thank
events.
you
Yeah,
so much,
wear
Jared. It
your
was my pleasure.
wear your helmet, right?
Goodness. Yeah, we won't talk about that on this. All
Yeah.
right.
All right. Yeah. Thank you, Stacey.
Thank you. We'll see you later.